Hello, everyone. My name is Jared Barnett. I am in my final year of my Master of Public Health program, and I am a community health worker with Oakland County Health and Human Services. And the topic that I chose to do is housing instability and its association with mental health outcomes in low-income populations. And the reason I chose this topic is because I work in public health, and a lot of my a lot of what I do is to kind of address housing instability, and that is one of the main social determinants of health that we do see. Uh, as a community health worker, my job is to assist clients with accessing resources, and housing is probably the number one resource that people have difficulties accessing. And the framework that I will be using is a CSDH conceptual framework, which is a conceptual framework from the WHO that looks to for action on the social determinants of health by conceptual framework that includes components of frameworks that are relevant to the topic with social, economic, and political context, structural determinants of health inequalities, and intermediately determinants of health intermediary determinants of health, excuse me. So this framework really looks to address social determinants of health on a policy level and on the structural level. Uh, it's used to address housing instability as a social determinant of health on the structural level and solving the housing crisis and its negative impacts on mental health upstream. And here, the impacts of housing instability, it has a negative impact on mental health. That's the kind of correlation of my topic. We see that unstable housing and homelessness is associated with a number of both poor mental and physical health. And poor housing quality is connected to depression, anxiety, and distress. And it puts the most vulnerable population at risk when you have unstable housing or housing instability. And the populations that we see at the highest risk happen to be low-income families and individuals, racial and ethnic minorities, people with disabilities, our older senior population, as well as the youth and mothers, uh, as well as the LGBTQ population. And those who are kind of aging out of foster care is another population at risk of housing instability and its impacts on mental health. Uh, and some of the causes of housing instability are on the government level, government policy level, with policies that prevent or limit public funding for housing. Uh, a lot of people live in a lower income, and there isn't many housing vouchers or reliable housing for people who uh, would spend all their income on rental and rental properties, or and the displacement uh, of working and poor families, gentrification has displaced a lot of minority groups who once had kind of a public funding and subsidized housing in communities. We see that they are being moved out, and different populations are moving in who may be of higher economic status. And we see that it happens to minority groups at a significant level. Um, and there's growing income disparities as well that makes expenses exceed the income that we make. So usually they suggest that if you spend no more than 30% of your gross income on rent per month. And we see millions of Americans exceed that, they can get up to 50% or higher uh, spending on their rent per month. And a lot of people end up facing eviction due to the imbalance of gross income and the cost of rental properties. And another cause of housing instability is the exclusionary zoning ordinances that protect single family properties that like higher middle to higher class individuals normally live in. You see those single family properties that kind of outprice lower income individuals, and it reduces housing availability for renters. And policies that prevent multi-family dwellings and like duplexes that can house multiple families. We see zoning ordinances that prevent housing like this, so families don't get the opportunity to mix with different socioeconomic classes. So you see inequalities there that continue to perpetuate discrimination and oppression of minority communities in America through housing. And this issue has become so big globally that the United Nations, uh, for their sustainable development goals, uh, they list 11th on list sustainable cities and communities, and housing is a big part of that. Is creating sustainable housing and for those who live lower income, and another one is no poverty. So a lot of what the global goals are for the United Nations includes housing insecurities and its connection with mental health disorders. And my recommendations to combat housing insecurities and their kind of association to mental health is a comprehensive policy that addresses housing instability. Uh, by doing so, you can continue to minimize negative mental health outcomes in low-income communities. Using the WHO framework for tackling social determinants of health inequities, we can utilize that framework, which focuses upstream as far as policy making uh, and on a structural level for housing instability. And I think knowing what worked in the past as far as like housing vouchers and affordable housing for families in a duplex setting, I think studying the past to know what worked and having that research and having that data to present to show that it's possible to mix different incomes. I think having that data is important to addressing housing instability. And with shortages in affordable housing and limitations to where people can and cannot live, it is very important to uh, kind of restructure zoning and land use laws. We need to have reform that supports low-income families uh, so we can coexist with middle to high-income residents. I think there are several benefits to mixing and coexisting with different income residents. And doing so will combat the redlining and bias screening tenant practices of the past that we've seen in minority communities like Detroit and Chicago. Um, I think expanding rental assistance programs and subsidies to support low income families and those at high risk is another way to combat housing insecurities. And at the moment, there are a lot of people who face evictions when their rental property skyrockets with costs. So when we do see landlords who up the rent by significant amounts within a month and expect tenants to pay, we do need to provide free legal counsel for those facing evictions to provide them protection for those unjust acts when they do have evictions. So, yep, my name is Jared. My topic was housing instability and its association with mental health outcomes in low income populations. Um, Thank you for watching. See you guys later.